The brain. The brain is a very powerful tool. It is the command center of our nervous system. It receives, sends, and interprets information within and around our body. It allows us to function and see the world as our own, in our own perspective. As we speak, there are trillions of nerve cells called neurons connecting, forming, and ending connections within our brain, evoking those happy memories, reminding us of our daily routines, and suppressing traumatic events. As you can see, the brain is very important. It is one of our most valuable organs, which is why it is hard to understand the life of a person who suffers from schizophrenia, the mental disease where it's hard to trust the one thing we've grown to depend on, our brain. What is schizophrenia? Schizophrenia is a disorder that affects a person's ability to think, feel, and behave clearly. People with the disorder can suffer from a different variety of symptoms, like distorted thoughts, hallucinations, and feelings of fear and paranoia. What causes schizophrenia? It is proven to be caused by a multiple spontaneous gene mutation within genes that relate to the normal development of brain cells and neurons. Some experts believe that it is a combination of the genetic makeup and the person's interaction with their environment that can cause the start of schizophrenia. Other causes, scientists have argued that it is caused from the inability of the brain's neurotransmitter to send and receive information from cells, being exposed to a virus or other external detrimental factors at birth or in vitro, malnutrition of the mother prior to giving birth and/or problems during the birthing process, or that the brain possesses a different structure or chemistry that can create an imbalance which prevents the neurotransmitters from functioning properly. How it affects the brain. Research and autopsies have shown that people with schizophrenia have bigger ventricles, which are fluid-filled cavities that rest at the center of the brain. They also have less or more brain activity and less gray matter. Gray matter consists of neurons and cell bodies that is involved in muscle control and sensory perception. This allows us to take part in sensory perception such as seeing, hearing, memory, emotions, speech, decision-making, and self-control. One of the many misconceptions of schizophrenia is that people with the disorder only experience hallucinations and voices in their head, telling them to do violent acts. The truth is that people who suffer from the disease all face a different combination of positive, negative, and cognitive symptoms. Contrary to the name, positive schizophrenia is not good. It is where the stereotypical conceptions of schizophrenia stem from. It relates to being out of touch with reality. This involves having delusions. Delusions are an abstract and extreme ideas and thoughts that bear no base in reality. This typically involves thinking someone's trying to inflict harm upon you, or it may involve thinking you are famous or godly. Some individuals hear conflicted voices in their head, one telling them something negative, degrading, or to do something immoral, while the others telling them to do the opposite. Hallucinations. Hallucinations are normally interpreted as seeing things that are not there, and although that may be true, people with schizophrenia also hallucinate within their other senses as well, as in taste, smell, touch, and hearing. The hearing voices is one of the most common symptoms of schizophrenia. Disorderly thinking. Disorderly thinking is when one thought process is irrational and disorganized. For instance, they would try to formulate sentences but stop in the middle of it, or make up words that they would believe to be true. People with schizophrenia can have disorganized thoughts, where their thought process is either random or not in thinking in the right order of events. Uncontrolled movement. This involves sudden uncontrollable movements of the limbs like fidgeting, tapping fingers or feet, Other times they can experience moments of doubt, which is when they stay still, not moving for a long moment of time. Negative symptoms relates to the shutdown or disruption of emotions and feelings. It is normally confused with depression, which is why it is one of the hardest symptoms to diagnose. Some indications are neglect of personal care and hygiene, the inability to perform mundane tasks, and flat affect, or the tendency to speak slowly and or in monotone. Lacking empathy, the inability to derive pleasure from life, and silence and being unwilling to speak. Cognitive symptoms. Cognitive symptoms are very subtle and hard to detect. Sometimes, if undetected, it can prevent someone from living a standard life. Some of the symptoms involve a difficulty in getting and remaining focused on any task, or even a thought, not being able to pay attention to the instructions or directions, the inability to make choices when more than one option is presented. Hallucinations and delusions tend to be expressed around the age of 16 and 30. Treatments for schizophrenia have come a long way since the first antipsychotic drug therapies were introduced in the 1950s, but the disease is so complicated and so entrenched with so many potential symptoms and deviations that research shows no signs of slowing down. Some common problems with treating schizophrenic patients is that they become delusional and think they are being cured and withdraw from the medicine, resulting in a serious relapse. There is no known cure for schizophrenia, but with proper diagnosis and constant treatment, a person with the illness will be able to control the symptoms in order to live a normal, routine life. With atypical and typical drugs and psychosocial therapy, people with schizophrenia are able to eventually gain control over their symptoms and hopefully suppress them enough to the point where their worst symptoms are inexpressible. Because schizophrenia is a mental disorder that comes in many different combinations of symptoms, patients have to experiment with different drugs until they find the right combination of drugs that produce the right effects. Typical antipsychotic drugs are drugs used to treat the symptoms that are commonly shown in people with schizophrenia. Types of typical antipsychotic drugs are aripiprazole, olanzapine, paliperidone, and clozapine. Some of these drugs come with its own effects. For instance, clozapine can cause a reduction of white blood cells that allow us to fight against bacteria and diseases. Because of this, the drug is a last option drug, and patients who take it are subjected to consistent blood tests and checkups. Atypical antipsychotics, also known as second-generation antipsychotics or major tranquilizers, are used for patients who do not have symptoms that are commonly represented and need a different combination of drugs to help them take control over their own personalized variety of symptoms. Types of atypical drugs are chlorpromazine, fluvenacine, and haloperidol. Schizophrenia is a popular mental disorder with numerous misinterpretations and myths. It is not a form of depression. Yes, they can become depressed, but the disorder itself isn't depression. It is stated that caregivers of people with schizophrenia can become clinically depressed because it is an extremely difficult role to play, which is why many patients seek professional help. As stated before, people who suffer from the disease all face a different combination of positive, negative, and cognitive symptoms, so not everyone will experience hallucinations or become violent. People with schizophrenia need a support system. Patients who do not have a loved one, friend, or even therapist to lean on can become severely depressed, and likeliness of relapsing from medication will increase.